morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care. The theme of our Health Talk today is cerebral palsy. What is cerebral palsy and who are the affected individual? This During this presentation, I'm mostly concentrating on the cerebral palsy among the children. So, what is cerebral palsy? It is a birth injury. It is a group of neurologic disorder that affect the movement, muscle tone, and the posture. It results from injury to the developing brain that most often occurs during or after birth due to lack of oxygen. The areas mostly affected here in the is the motor cortex and the cerebellum. In order to make things simple for our viewers to know, the first slide is a picture of a baby with the brain and anatomy that shows cerebrum, parietal, occipital, and cerebellum. At the bottom, the cerebellum is the part of the body that controls the that controls the movement and stability in the body, that makes the muscle strong. Cerebral cortex, these are the two areas in the brain that that are affected, that the motor cortex and the cerebellum. So how do we identify the the early identification of cerebral palsy is crucial because of the intervention when the brain in the baby is developing, the areas most mostly the bottom part, cerebellum, and the cerebral cortex, they have not yet developed fully. So what happens to the baby? These babies are either they are born floppy, which is they are which is when you hold the baby, it just you cannot control their head and neck, or it is like a stiff kind of baby. When you raise the baby, there is one side of the extremities has got increased muscle tone. So to make the thing simple, I do have a couple of other slides that will show the babies. So first of all, I want to go through what are the signs of cerebral palsy. I divided it into three groups. The early signs include a delayed developmental milestone, abnormal muscle tone, like I mentioned before, either they are too stiff, too floppy, a poor coordination, and a stiff leg or the fisted hand, poor head control, difficulties difficulty in swallowing and feeding, which is a major complaints. And also these babies have a very poor or absent reflexes. So the signs in infant under 6 months: poor head control, stiff floppy baby, poor eye contact, and a delayed feeding. Next slide, please. So these are the summarize the types of cerebral palsy giving this problem. Spastic is the most common type, that is 70 to 80% of the babies affected, and you can see from the slide they have an increased muscle tone, stiffness, and a tight muscle. Ethetoid type, like they have an abnormal, uncontrolled movement, ataxic type, difficulty with balance and coordination. And 10% of these cases have a mixed symptom of more than one type. So these are now, as we follow these babies, what are the signs early? Signs in the older babies and the children, that includes the baby doesn't roll over. Keep one hand twisted when you hold the baby. It is like a scissor-like posture. Like one side of the body is very rigid, and another thing is down. They are unable to crawl, and instead of crawling, these babies they scroll on the bottom instead of crawling. Cannot sit or stand without support. And all these findings in the babies, I have documented it in the next slide. So this is what is cerebral palsy. This is a very good slide that I have prepared for our viewers to know what are the potential warning signs. If your child is missing milestone, he or she may have developmental condition. There are other developmental conditions besides the cerebral palsy, but here we are mostly focusing on them. So at the second paragraph, I have given what a baby 0 to 3 month looks like. Baby is lying flat, poor reflexes, and poor muscle control. A 3 to 6 month old baby, they are unable to hold their head. They are lagging behind. There's so much of developmental delay that is an alarm sign that the baby is not right. When the baby is like 6 months to 1 year old, you can see that they have trouble with the fine, gross motor movements, lack of familiarity, and a very poor coordination. By the time it is 1 year old to 2 years old, the muscle tone is awkward, like you can see, because of the poor cerebellum development. And those are the signs. These are the early signs that 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 needs in focus of attention. The early intervention means a lot in the growth and development of these babies. Next slide, please. So this is the slide of a child that I have included. There are different kind of cerebral palsy, like I said before, and the different how do they recognize an early intervention is going to be a very important factors in this. So the early interventions depends upon how quickly the diagnosis is going to be made. What are the early interventions? Well, in the next slide, I have prepared. But before I go to the next slide, I do want to talk about what are the factors that affect the baby. The risk factors for cerebral palsy include premature birth, low birth weight, advanced maternal age, infection during the pregnancy, lack of oxygen to the brain during the delivery. Other major contributory factors include maternal smoking or excess consumption of alcohol. And during my residency and fellowship with the neonatals, I did notice there are fetal alcohol syndrome. Mothers who drink a lot of alcohol, the babies are born jittery and they are the one who needs treatment right away because there is circulation of the catecholamines in their blood, and so the early intervention is needed. So next slide, please. Next slide, please. So this is, I summarized everything. All this thing, what I'm going to talk to you about is all these slides are prepared after doing a very extensive research studies from different areas, from the different journals, CNN and more, Academy of Pediatrics, and the bibliography have included all. So what does early intervention means? Well, first of all, it starts with the nutrition of the body, nutrition of the baby, which is very important. They have a very delayed feeding because their swallowing reflex has not developed. Nowadays, there's so much advance in medical science. Things are more easy now to feed these babies by putting the tears. But in the early 20s, during when I was doing my residency, we didn't have all these facilities. Basically, we try to feed them. The nurses are assigned and do that. No reflex, they are vomiting. So nowadays, the early intervention, this is focused around the whole circle that I have included: child's functional abilities and supporting an overall development. Rehab programs are very important for the management of these babies. Physical therapy, exercises, adaptive equipments, like there should be proper kind of swing and all this. Communication support strategies are very important. That is, the parents, the caretakers, they should be properly communicated. They should be available to talk to regarding the upbringing of the baby. There should also be a training for a daily living activity. So what happens when you give the early therapy? It can significantly improve the mobility, independence, and the quality of life. I have I added some note about the recent modalities in early intervention. I summarized the whole thing for everybody. So the recent advances in infants emphasize the integration of standard assessment tools and emerging technology. The rehab centers, they play a very important role towards the upbringing and of these babies. Combining such tools, such as a general movement assessment tools, the Hammersmith, which is infant neurologic examination, the neuroimaging, that is MRI, when indicated, all this plays a significant role in the early identification and timely intervention. These tools, they enhance the diagnostic accuracy and they guide the individualized early intervention. In addition to the traditional assessment, the technologic intervention have become an important component of early tools. These include such as robotic, virtual reality, neurofeedback, and visual and auditory support. They support the neuroplasticity. Such approach, support the neuroplasticity. That is, they include during the development of these babies the brain. So improve motor learning and expand access to the specialized care. Early intervention also has the potential to profoundly change the lives of the infant with cerebral palsy by improving their functional outcome, overall quality of life. A recent advances in diagnosis and treatment also include stem cell therapy, robotic exoskeleton for mobility, and selective surgery like a dorsal rhizotomy. I didn't want to go into the details, but most of these things have been reported from journals in Australia, the journal in Britain, American Pediatric, AMA, and more. And all the things are included in my bibliography. These modalities aim to improve the motor function, reduce the spasticity, and enhance the independence and the participation. One of the most important thing I have not been able to mention is the emotional reaction in the parent. When the child is born, there is so much of emotional upset in the parents, the caretakers. So these are the people, they need a lot of moral support. These moral supports are mostly done by the social worker, the social service consultation, and all these kids, all these parents, they should be joining the social service area. And I have a lot of respect for the rehab centers that is all over the world. The tools are basically the same, they are standardized. And uh, this is just so that we know that some of these children born with the cerebral palsy, they have either mild symptoms, moderate, or severe. The mild symptoms, they can still, with all this occupational and physical therapy, they can still survive, and they can handle their needs, and whatever can be done for them. The one for the severe one, they are the one who need more aggressive treatment. And this is what the third part is about, the surgical intervention in those individual. So rehab center, the rehab proper rehabilitation center, the disability, they play a significant role. Next month, March, is a disability month where where the children with the disability, especially cerebral palsy, they are being they are being more advertised and taken care of, and the person taking care of those, they are wearing like a green ribbon. I think I did it one time ago, but now I forgot. So in summary, I have presented to all of you a very clear picture of what a cerebral palsy is from a pediatrics perspective. I am not a I'm not a specialist in, but from the pediatric perspective, these are the symptoms, and we refer this patient to a pediatrician, to the neurologist, the occupational therapy, and the rehab. So basically, one more thing I wanted to add to my thing is now federal government have sanctioned lot of money for the taking care of this disability, and it is a disability. So there's the future seems like it is bright. We don't know what will happen in future, but the future is bright because surgical because the science has advanced so much, and new things are coming up. Now I like to thank our viewers for watching me this video presentation of our case of cerebral palsy from the pediatrics aspect. Thank you again. I like to thank our producer for producing this video, and I like to thank our uh, our viewers who are able to watch it. And I'm sorry that one of them could not be connected. And that was the connection in India, like in an Asta Center. Asta Center is a major rehab center located in a state called Patna in Bihar, and they have a lots of things going on in their Asta Center, like educating these children. How are these children being educated with all these handicaps? Any question from, I see one, Kumut, any question?
A very nice presentation, Dr. Prasad. It was very educational. Congratulations and thank you for doing this.
Thank you.